Good morning, guys. My name is Tony Maritato. I'm a licensed physical therapist, and welcome to the Choose PT First YouTube channel. In today's video, I want to talk about an article I just published on the website answering the question, does poor posture cause shoulder impingement and result in shoulder pain? So first, let's clarify a couple of the terms. What is poor posture? I think most of us would assume poor posture is slumped shoulders, forward head, somebody who's slouching, somebody who's not standing tall and erect. And while, yes, we classically consider that poor posture, that doesn't necessarily mean that it's bad posture. What if I drop a contact lens on the bathroom sink? I'm going to be in that forward head, shoulder slouched position looking for the contact lens that I dropped. What if I'm in a low light or I have poor vision situation and I'm trying to see something? I'm going to have that forward head, slouch shoulder position. What's more important than the position you might see in a moment in time is a human's ability to change positions. So if I can slouch, I also want to be able to get tall. If I can flex my shoulders forward, I also want to be able to retract my shoulders backward. So I would say the more current research suggests that there is no qualitative good or bad posture. Posture is only as good or bad as it is for whatever it is that you're trying to do. And as long as you can maintain and move through various postures, that's the most important part. So does, let's say, a classically, forward head, rounded shoulder position cause shoulder impingement and result in shoulder pain? Well, shoulder impingement is when the bone on top, which is the acromion process, and the bone below, which is the humerus, pinch the soft tissue between the two bones, usually the supraspinatus tendon and the bursa. When I reach up, those bones come together, they pinch. If that tissue is sensitized, I get pain. If that tissue is damaged or torn or impaired in some way, I usually get pain. That would be considered shoulder impingement syndrome. And so what we want to look at is the direct relationship between posture and shoulder impingement. We know from imaging studies that a person can have great posture and experience shoulder pain. We know that a person could have classically considered poor posture and experience no shoulder pain. And then there can be every variation in between. So the relationship, the direct cause between posture and shoulder pain is not a very good relationship. It's broken down through clinical research. It doesn't really support a cause and effect. Correlation does not equal causation in this case. So the next question that we want to get to is effectively, what are some of the symptoms of shoulder impingement? We know that there's localized shoulder pain. Occasionally, there'll be radiating shoulder pain. Some of my patients will say that the pain radiates down the outside of the shoulder, outside of the arm, all the way to the forearm. It's not uncommon that they'll experience those symptoms with overhead reaching, lifting, pushing, and pulling. Some of my patients will experience pain at night. Some of my patients will experience a sharpness to the pain, while others will more often describe it as kind of a dull, throbbing, aching sensation. When we're talking about how shoulder impingement is diagnosed, there are a couple tests for it. Certainly, most orthopedics will do an x-ray to look at the bony structures of the shoulder. They may or may not see what's called a bone spur, a bony growth that's coming off the end of the acromion process. Perhaps that bony spur has been there for 20 years, but you're only now starting to get symptoms of shoulder pain associated with shoulder impingement. It's not unusual that you could have a bone spur with no pain, and then you do something, the tissue gets sensitized, and now all of a sudden you have pain. Other components that are important to diagnosing shoulder impingement syndrome, we look at imaging, we look at a physical exam. So a physical therapist, orthopedic surgeon will move your arm around, will test certain structures within the shoulder, soft tissue elements, bony elements, ligaments. We want to make sure everything is intact. We want to make sure the shoulder is stable. We'll also do other special tests. In some cases, they might order an EMG to check the nerve conduction velocity to make sure that everything on the nervous system is working correctly. A thorough medical history. The individuals who do a lot of overhead activity, either for work or recreational sports, they have a higher likelihood of developing what we would call shoulder impingement syndrome or pain in the shoulder. They also have a higher likelihood of developing rotator cuff tears. So we want to look at the whole picture. We want to look at past medical history as it relates to comorbidities. That could include diabetes. That could include cardiac issues. That could include blood pressure. We also want to look at lifestyle. How well do you sleep? Are you a smoker? Are you drinking alcohol? What are some of the factors that are going on in your lifestyle that could be contributing to the symptoms and the sensitization of the tissues in the shoulder? All of this is going to come together to finalize a diagnosis of what we think might be causing your pain. When we're looking at other types of problems that could arise, could be correlated with what we consider poor posture, we want to make sure that we look at muscular imbalances. If I'm consistently spending time with my chin forward and my shoulders rounded because that's what I do for work, maybe that's how I sit down to eat a meal, maybe that's what I do recreationally if I'm gaming or doing other things, the more time I spend in that position without spending time in the opposite position, I could reasonably develop muscle imbalances. So we want to look at, are the short muscles, are we capable of stretching the short muscles? Are we capable of tightening the loose muscles? Like, we want some level of muscular balance to make sure that the muscles in the front, the back, and the sides of the neck and shoulder are working optimally. We want to look at other orthopedic conditions. If I'm in a situation where my head, my neck, my upper back is in a certain position, my lower back and my hips tend to compensate. So if my head has to come forward to look at something closely, my low back has a tendency to want to flex. That's reasonable. That's what happens. It's a normal reaction within the spine to maintain balance. But if I never change that, if I never go the opposite direction, if I'm always looking down and never look up, I don't get the other side of the compensations in the rest of my spine. We want to look at lung function. One thing that I will say is if we tend to flex through the thoracic spine, we might not get the same level of thoracic rib cage expansion and compression that would influence breathing. It'll influence the digestive system. We have a large intestine, a small intestine, a stomach. We have an entire gut with its own ecosystem inside our body. And we need to make sure that those structures have room to function the way they need to. Other important organs like the heart, the liver, the kidneys, everything is within a confined space. And so if we take that container, which I'm going to call your trunk, and we compress that container, everything has less space. Everything is under more stress. So all of these things, while they may or may not contribute to the topic tonight, which is shoulder impingement and shoulder pain, there are important variables and factors that you should be talking to with your physician, your surgeon, your physical therapist. When we talk about physical therapy specifically, every therapist is going to have a little bit of a different approach to treating and working with somebody specifically related to shoulder impingement syndrome and posture. I can tell you that my approach is one of kind of general function. I want somebody to be able to lift and push and pull and carry and throw. I want somebody to be able to reach overhead, reach down to the ground, and reach behind their bodies. Like, I'm a big believer in human movement as naturally as we can. And the more natural the movement, I believe the better it is for our overall health and functioning into adult aging. So we want to talk about strength, posture. We want to talk about ergonomic setup. So if you're at work and you're seated most of the time, we might look at varying so that you sit for a while, you stand for a while. If you are going to make multiple trips to a copier, to the bathroom, to the waste bin, where before to optimize for efficiency, we might have done all of that in one shot. Now we tend to break up the tasks we have to do during the day. So maybe I get up, I go to the printer, I come back down. Then an hour or two later, I get up, I go to the bathroom, and I come back. And then another 15 minutes, I get up and I go, check the mail or whatever it is that needs to be done. But the idea is that I sacrifice efficiency to improve the health and the positioning of my body. That's a great way to manage some of the stresses associated with static postures that you'll experience throughout the day. And your physical therapist will talk to you about this, specifically related to shoulder impingement, shoulder pain. We want to have a series of exercises that not only strengthen the rotator cuff, but also change the chemistry. One of the things that I see in my physical therapy clinic, I've been a physical therapist since 2006. I've been a private practice owner since 2001. I was a strength coach for a long time. One of the things that I see consistently is a patient will tell me, when I first wake up in the morning, my neck and shoulder are super stiff. And then as I get moving through my day, by around 10 a.m., I feel my best. I'm loose, I'm mobile, everything is feeling great. And then by the evening, I start to experience limitation and pain again, but it's a different kind of limitation and pain than I had in the morning. The morning was more about stiffness. The evening is more about pain. And so that, to me, is an indication of generalized inflammation. Now, inflammation is important. Inflammation is a component of healing. Inflammation is a component of repairing tissue, of battling viruses and bacteria. We can't survive as humans without inflammation. We need it in our lives, but we want to manage that inflammation. And so when somebody tells me that they're stiff, then they feel better with moderate movement, then they increase pain later in the day, that's consistent with signs of inflammation. If somebody tells me it hurts, they take an Advil, then it feels better, or any over-the-counter medication. What that indicates is that if you change the chemistry of the body, the symptoms you're experiencing will change also. And there's lots of different ways to change the chemistry of the body. If I do a low intensity, submaximal exercise for the rotator cuff and I do 20, 30, 40 repetitions, I will change the chemistry local to the shoulder. And in most cases, the shoulder will feel better for a short duration. It might feel better for 10 minutes. It might feel better for 15 minutes, but then it's going to go back to being stiff and sore. And so unlike prescribed medication that has a set duration of time, you take this medication that's been prescribed by your surgeon, for 6 hours you feel better, then the pain comes back. If you do a prescribed exercise program that also changes the chemistry, you'll usually get the same kind of relief of symptoms, but it might only last 15 or 20 minutes, and it would have to be repeated then. And so that's where, in another video, I'll share my 5, favorite desk stretches so that you can stretch and mobilize the neck and shoulders in a way that just takes a couple minutes, probably not even 2 minutes in total time, but will produce that short-term chemical change to reduce the stiffness, reduce the pain and soreness, improve your function for the next hour of work until you do it again. So guys, I hope this kind of information is helpful. I plan to share more of these kinds of videos and these kinds of articles that are practical things that you can do every single day at home, just to maintain the general function, health, well-being of your body, your joints, and bring you better independence. Guys, thank you so much for watching. Subscribe to the channel if you haven't, and I'll catch you on the next video.